Welcome back. My name is Connie. Welcome to Mzansi Oz Diary, Justice Unmuted. South Africa's healthcare system is buckling under two silent epidemics. The first one is rampant identity theft, where illegal immigrants and criminal networks exploit stolen IDs to hijack medical resources. The second one is the collapsing frontline workers, nurses, pharmacists, doctors, and other healthcare professionals are drowning in unsafe patient loads.
Is at a healthcare facility in Rosettenville, in the eastern part of Johannesburg. Mobile, you can hear, a divergence of views around this, but the experience is, and we're hearing from activists who are blocking people from entering those facilities, saying that it's because they are being deprived care, and it has led to some confrontations in certain areas. So talk to us about the picture where you are.
Oh, yes, indeed, man. In fact, they're saying that at this point, they're looking at the fact that South Africans need to be attended first. According to some of these activists, and I'm going to step out so you can see, who are currently here, they're saying that basically them guarding the area specifically looks at the fact that South Africans are not deprived of some of these clinical services that they require in this area. However, at this point, it does look a bit quiet, mainly because they've been here for quite some time. So I want to bring in a lady who is also a community member in this area, but also in helps in terms of the clinic. Mama, at this point, we are hearing from what these various groups are saying, but is this working out right here?
With regards to their demands?
Yes.
Actually, hence this group has been here from the beginning of the week, and then we had to intervene with the Lendo councillor because they have mentioned that they will not allow non-South Africans to be Lendo tended to. And in our ward, in this, from the council point of view, as the councillor had already alluded earlier on, that we have to help all those people according to our constitution.
All right. And as someone who's part of the committees within the area, what are the issues that you are seeing that are maybe prevalent in this area with regards to health, and what the groups are saying march on march that is blocking at this moment?
Okay. What I have observed here in this Lendo clinic, the Lendo problem here, this clinic is overcrowded. I would say around about 70 to 80% of foreign nationals that are attending this Lendo clinic. And on the other hand, there is what is happening here, which is the identity theft. Because we've had quite a lot of cases that were reported to me even last year. And we had called the police from Moffat View Police Station to attend and arrest those people. When I say those people, I want to be specific. Foreign nationals that had used South African IDs. Because some of these South African IDs that they use, they rent them or they pay South Africans. You'll understand. And then you find that maybe 4 or 5 of them, pregnant women, using one identity card.
Those are strong allegations, Mama. Is this something that you have brought to perhaps the Department of Health, where you guys have noticed that someone is using a South African ID when they're not?
Yes, Mobile, we do have proof because the fact that police were called in my presence, in some of these cases, not all of them, they were brought to Moffat View Police Station. And then after that, it was just quiet. It was not one case. Nothing happened.
That is shocking. Now, she spoke of identity theft. So, a danger of multiple people using a single identity number to access health care that they are not entitled to. So this, it's got a very serious implication, and this, one of them is this financial strain on the healthcare system itself, because fraudulent claims, they increase the cost for governments, for insurers, and the healthcare or the healthcare provider. This is actually a public health system, so they definitely increase the cost to the government and also increase the cost to the manager of that facility, because they need to have a budget and account that budget. The second thing what this does, that's already showing why people are so upset about it, is that the limited resources that's now been diverted from legitimate patients, leading to those patients not being serviced or waiting for longer time, and also that also reduce the quality of care they receive. The second thing this thing does in terms is the identity theft itself and the privacy risk here. So because you got the real owner of the identity number may face medical identity theft as well, where their records get mixed with fraudulent entries. So, incorrect medical histories like allergies, the condition the person may have, the treatment they received, can lead to life-threatening errors in future care. That is a very serious risk here to the healthcare workers and the person. So now the third thing that we need to look at is there are legal consequences. And the lady has said that they rang the police, and the police, they don't know what the outcome of that because of the privacy, I would assume, because they wouldn't know what the police are doing about it. But they keep seeing these people coming back because you saw the image that I showed you in the last video about the image, how it looks like, the image looks like, because how would you know who's who in that image? Now, those committing this fraud, like I said, they may face serious fines, prosecution, and imprisonment. And the legitimate holder of this South African ID, which in this case is alleged South African citizen, also may also be accused of fraud. That they also are complicit to this, because if it's true that they are intentionally giving these people, knowing they're illegal in South Africa, their own identification to access entitlement that they're not entitled to, it is fraud. That is fraud on itself. All right, they are participating in fraudulent activities. The fourth thing, this information, this whole clip, what it does is the compromise public healthcare data. So when you have fake or duplicate records that distort the health statistics, and I'm saying this because I've looked at the statistics in South Africa around HIV and AIDS prevalence. There's a lot of number wangering. Okay, there's a lot of numbers wangering. It's all I can say. There's number wanger, meaning numbers don't add up. That's what we say here. There's a number wangering around it. It doesn't add up. So it actually distorts the health statistics. It affects disease tracking, vaccination programs, and policy decision, because then you don't know how many people are suffering from what condition, and you cannot drive public health care messaging around prevention because of this issue around the data itself. It's wangering around. Like I'm saying, it's number wangering, this data. So it compromised that public health data that's so crucial around planning. So now you got also another thing that is happening now. We've seen now that arising around the South African public. It is erosion of that public trust in healthcare system. So because the widespread fraud, it can actually also lead to this stricter verification processes, making access harder for genuine patients. And this is what we're seeing now with this group. That's what they're trying to do, whether it is, dignify or not dignify. This is this verification process for them. They're thinking by standing this healthcare facility and checking people's identification themselves and ensuring that people who are not entitled to enter that facilities are sent somewhere else, then that people, right people who should be entering the facilities are service first. That is actually what is the erosion of public trust, and also the general perception of public confidence in healthcare institution may decline over time, and you can see that starting to emerge as a decline. This also another thing that she has going to talk that she's going to talk about now around this potential organized crime exploitation, and we're going to listen to it now. Why I'm saying that there's some potential organized crime exploitation. Let's listen to her, and I'll tell you why I'm saying that.
After they were taken by the police, yes, in full view of people here.
So, Mama, maybe what would be the solution in this case? Because we know that as part of rights for people who are South African and who live in South Africa, they all have a right to health.
I think in this meeting that we will be engaging all stakeholders, we would love to have some of the departments, like the Home Affairs Department, should be part of that. Immigration as well, because most of these clinics, they are suffering precisely because these very same people, they go to this clinic today, Rosenville Clinic, and then there's no record. Then after 2 days, they go to another clinic, you see, and then they'll be attended to because they are patients. But it is not right at the end of the day. I'm not trying to be xenophobic, but I want to address this issue, because I am involved in this clinic, you see. And
so, as I said to you guys, that this potential for organized crime, there's multiple clinic shopping. Going to number of clinics is consistent with what the story we've had yesterday from advocates who were saying that these people, there's some allegation that they go to these different clinics in South Africa to have medication so they can resell those medication into their own countries.
What we know is that if you listen to the video Rich, uyayimentiona le nto futhi into esiyaziyo sonke ukuthi laba futhi bokufika bengene kuleso sibhedlela bethathe medication and go to another clinic beyithathe leyo medication beyoyidayisa emazweni abo. We all know that. So if we do not protect our nurses and doctors and hospitals and our healthcare system, it is definitely going to collapse.
These are the allegations. So multiple clinic visits, clinic shopping by the same individual using different IDs or location. They deplete stockpiles of essential medications, and such as antiretrovirals, the ARV, the antibiotics, and chronic medications. This is what the stories is coming out of the community out there, that they don't get their medications because the stockpiles get finished and they don't often get what they meant to receive due to the shortage of those medication, consistent with what the lady's saying. So the issue around this organized crime, when I say it could be potential organized crime, the black market for stolen medications. So if these illegal immigrants or criminal networks resells government provided medication at inflated price, it creates a dangerous underground market. So a patient who cannot afford this black market prices may suffer or die without treatment, because then they resell it. We don't know who they resell it to. The stolen antibiotics is what I'm concerned about, or antiretrovirals. If misused or underdosed, can contribute to drug resistance, worsening public health crises like TB and HIV. Like I said, the statistics around HIV and AIDS in South Africa, the data is wingering. Okay, that's how I can put it around it. There's the numbers swinging around it. So this identity theft and legal consequences for poor South Africans, has several consequences and long-term consequences. Because the South African themselves were selling it, now we're looking at them selling it as alleged, their medical records could be corrupted with false entries or incorrect blood type or diagnosis, leading to life-threatening errors in future treatments. They also may be held for fraudulent billing or deny social grants if suspicious activities is linked to their identification number. And also these criminal syndicates could also exploit these stolen IDs for broader fraud, such as bank fraud or tax scams. So another fourth thing about this, it's got a huge implication for South Africa for national security and immigration risk. So when you have a weak identification verification in healthcare, which enables illegal migrants to arm themselves deeper into the society, making that deportation harder, as we've seen right now. If healthcare fraud is widespread, it could also, as we have seen, some of the people were saying that they could feel these tensions that is arising. As citizens now, we've seen these community groups now are sitting in these clinics that they deem to be at risk for being, not having enough medication, or because of the number of illegal foreigners that are in those clinics. And this is, and blaming them for the collapsing of services. So this is also another thing we also must also explore and think that there could be some corruption and weak enforcements. And why I'm saying that the reports that there are no records. Why no records? If it's not written, you haven't done it. That's the motto of healthcare. If it's not written down, you haven't done it. So why there wouldn't be no records of this issue around people being given certain medication and not being able to track those records of the very same people with the same identification number in the same area? So some clinic staff, I'm not sure, allegedly, they may be complicit, such as accepting bribe or overlook these fake ID in an effort for them to work faster and be able to finish their job. I'm not saying this is what's being alleged, but this could be a possibility. And also it could be also poor some digital records as well, keeping in the private clinics, which also can make it very, easy to exploit the system as well. These are the issues that this whole segment around the public health crisis in South Africa has around this identity theft. So now let's listen further. I think she's going to talk about this stuff relating to the ratio, the work ratio around nurses in these circumstances. Because again, the funding is for smaller community, and then you have influx of illegals having counted for, and there is no accountability even from the health officials about how they're going to deal with this issue. This is the consequences. The communities do suffer overall. And we're going to look at that and listen to this lady who is going to speak a bit further about what she's seeing on the ground. Let's listen.
Also, the number of the patients that are being attended to by the professional nurses, I don't think it is fair. For one person on a daily basis, attending to more than 60 patients a day, you know, how would you expect them to be productive at the end of the day? These people that are working here, they have families, you know, at the end of the day. They are human beings.
Yeah. She's talking about nurses, practitioners who would work close to being doctors, but not quite doctors, and workers. I think in Britain they call them medical assistants, but they're very advanced nursing. It's not just typical nursing. And so they see patients as they were for consultation. So they're seeing about 60 of them patients per shift, an impossible workload. That is the huge risk for lives. All right, that is massive. So the under South African healthcare, like they don't have really a clear guideline around ratio. They have rely on the Occupational Health and Safety Act. So the employer must provide safe working environments. The Nursing Act and Health Professional Council of South Africa guidelines where nurses cannot be forced to work beyond safe capacity, and patient neglects equal to professional misconduct. So, and also they have also another act is Labor Relation Acts. So there you have a right to refuse dangerous work without unfair retaliation. These are the three protection that they have when the workload. They can also have right a formal refusal for unsafe assignment um, before they engage in it, and they always have to document this unsafe working condition because they cannot provide safe care to the patients if that load is so high as being described right here. So the human rights group people, they did condemn this community vigilantism, blocking access to illegal immigrants to healthcare facility. But they also the issue that they ignore the root cause. The problem I have with it, they ignore the root cause of it. Illegal immigrants overburdening the clinics that they don't have an entitlement to, because it, like I said yesterday, it's a right to have care services. Everyone has a right to healthcare services. So there are other healthcare services, the private healthcare services. Why are they using the public health in a community where it's based on entitlement, underdeserved community, where the staffing is so low? So this is a problem I have with this whole thing about this issue. Now, it has led to a lot of staff burnout, and you've seen the nurses who was talking about and online about the risk they're facing around working in these conditions. And really, it risks the collapse of healthcare services. This is a problem. Yeah. It is a big problem. And the healthcare workers, they must force accountability because this must be addressed very fast. You cannot have such a work condition like this. It's not acceptable. It's not because South African human rights, they say everyone has a duty to healthcare, and they focus really around this called Section 27 around discrimination. But they also ignore very serious, like this 70 to 80% patient in some clinics with fake illegal immigrants with fake ID, that they ignore that. That's very serious as well around privacy. What are you going to do about that? And they also have nurses as well, collapsing under this 60% plus ratio. And the result of these drugs on the black markets, leaving citizens where this public health system was designed to address the inequity of the past untreated, remain untreated. That is not, no. That is in itself, you really have a failure to provide safe, equitable health care just by mentioning these factors around it. They're really punishing these symptoms rather than actually addressing the problem, the disease. Why having this problem for illegality? Well, you got very clear pathway to formalization, claiming asylum, and applying for refugee. Why are these not done? Why are we having this influx of illegality? People, legal immigrants are defined as people who in the country, they're not there for claiming asylum or refugee. They are there for something other than that. Like say now, suggests to me they're there really to steal stuff and sell it elsewhere. More criminality based network rather than actually even people who really need some kind of protection. At this, the way it's been presented here, the information that's public available and discussed in this video, and what I've said the other day with the video I've showed you about this whole issue around this fraudulent healthcare access with via the stolen IDs, the government failure to secure the borders and verify patients, and the collapse of services due to unsustainable demand. This is very unsustainable. Unsustainable. Cannot say that these people are providing safe healthcare under these conditions. Not at all. Cannot say that it's a safe healthcare being provided for these communities. They already now even being given a substandard healthcare by this design of this stuff. Unbelievable. This needs to be addressed. It really needs to be addressed very quickly. It's absolutely an important one that they need to address. All right. So now that it's on the public sphere, I'm definitely going to make sure to keep an eye on this one because it's this important for safety and for making sure that these resources are shared equitably and we're not promoting the misuse of one services over the other, because there's still a private healthcare in South Africa. There's still, doctors, private doctors, clinics that people can go to. And these people are illegal. They're not entitled to this public healthcare system as per my understanding. That is this, everyone has a right to healthcare access, but there is no way it says everyone has a right to public healthcare, free public healthcare access, or free, um, you know, access of any services. They need to be paying it for it, and there needs to be a system in place how these people can get it. But we shouldn't even have the issue around illegality. I'm getting frustrated, even the term itself. There are people called illegal when there is actually a clear pathway for people to be noticed that they are in the country. I mean, yeah, this is, I'm a bit concerned about that one, that illegality, the term illegal people. Now, the biggest issue that I would like them to really look at, they need to look at this to change policies. The policy change is actually needed in this place. They need to actually have home affairs checks at the clinic in this clinics, because it's not an emergency clinic. And they also need to actually have a biometric healthcare access, just like they have in India. I had a look at that. India had Aadhaar system. They have a biometric access. They really need to link everything, the healthcare to pharmacy, and also to the home affairs. You cannot have the system like that. And that you have to have this data matching technology in there around catching these people who are doing this. So when they go to a next clinic, that clinic will know that this person has came to my clinic. But then if they're using someone else's ID, then it's difficult to even catch it. But you can still have the data to be able to have a pattern as well. This is important that the health minister, make sure that they deal with this issue very quickly, because otherwise the healthcare will be depleted, especially around medication. It will actually lead to new infection, resistant antimicrobial, because people will be given less dosing of the medication they need. Or the worst part is that this will be misused as a black market and create these diseases that are not, this, super bugs that cannot be killed by the available antibiotics. So it's not a safe system now, and everybody needs to go there and work. Cannot defend this. This is not defensible. Cannot defend this stuff. It must be dealt with quickly and fast. All right. Thank you guys for listening. If you're new here, please consider subscribing. Until next time, see you guys.
I do believe that's something that you perhaps need to also bring towards the Department of Health to highlight such issues. And I want to bring Iman, what the lady is speaking about here, is just explaining to us about the sort of work that they do as part of the committee within the area, but also as people who live in this area. They talk about how there are so many people that come to this clinic, and that really speaks into the fact that most of our departments of health facilities are seeing quite a lot of people going into these facilities, and perhaps there might be more than what they have in terms of the people that are working there. But this is an issue that has been highlighted before, and what she's also explaining here is that they feel that at this point most of the issues that they've brought forward have not been attended to, and one of them is the identity issue. They feel at this point that there are some identities that are being used which are from South African people but not necessarily by South Africans, and these are things that they've brought to the police for. But it highlights what the councillor was saying, that if there are issues like this, then the Department of Home Affairs must be brought in to talk to these issues. But of course, at this point, we know that there is that group March on March currently at the gates, just saying that they will continue to monitor this area until South Africans get the service they deserve.
All right, Nqobile Madlana, thanks for that. And there is, as we said, a growing trend of this happening across Gauteng. And let's talk about it more with